So the two most common sleep disorders in women are still the two most common sleep disorders overall, that being insomnia as well as sleep apnea, although the prevalence of insomnia is much higher than that in men, whereas the prevalence of sleep apnea is overall lower than men as well, although the prevalence of sleep apnea in women increases during perimenopause. And restless leg syndrome is another sleep disorder that also disproportionately impacts women. And specifically, sleep apnea in particular can present quite differently in men than women in terms of the hallmark symptoms that we tend to think about. Hormones certainly play a role in how women experience sleep, as well as their role in sleep disorders as well. And that really occurs across all stages of life. We know that there are changes reporting in sleep symptoms that women feel at different stages during the menstrual cycle. We know that during pregnancy and postpartum, there are significant impacts on sleep, some just due to the physiological change of pregnancies, some shifts in sleep that occur postpartum, and certainly also the context of the changes in the social demands on women at that time as well. And then I think what the phase of life that is garnering even more attention this stage is definitely during that perimenopausal stage in women, where we know that there are dramatic shifts in the women's hormonal milieu, which in part, similar to other stages of life, is part but not all the story of when we see these changes in sleep symptoms that occur and increased risk of sleep disorders that occur in that stage of life. So we know that women have significant sleep problems, and we're hoping that this initiative we're able to not only shed light on the widespread problem of sleep in women, but to be able to identify both gaps in our science and gaps in clinical care and raise the recognition of sleep disorders in women. For instance, thinking about atypical presentations of sleep apnea and realizing, again, during that menopausal transition, that the sleep disturbance that's very commonly reported by women is not just shrugged off as the typical changes in life, and that it necessitates evaluation, careful differential diagnosis, and we do have existing therapies. Multiple therapies across the board to really improve the overall stages of life. So we're really trying to both put women's sleep health on the map, knowing that sleep disorders do present differently in women, and there are also differential impacts on how they're recognized and also treated, as well as the need for more research in the area as well. We're also hoping to educate physicians and other clinicians about sleep more broadly in general, and also to work with other partners and advocates and industry members to really generate the science and devise ways in which we can implement effective treatments for sleep in clinical and community settings as well. Sufficient sleep is one of the three pillars of a healthy life with good nutrition and regular exercise. Insufficient sleep contributes to risk of several of today's public health epidemics, including cardiovascular disease, diabetes, and obesity. And those with sleep problems should talk to a medical provider who may refer them to a sleep team at an accredited sleep center for health. For more information on healthy sleep, you can find a local accredited sleep center near you or go to sleepeducation.org.